Okay, let's look at this really quickly. Like I said, I don't really know if this goes with this chapter, if it might go with a different one, but it kind of covers different things. This is actually from a different place than a book. So a lot of things I've added into this course are that's from like a whole, like a lot of places. So they kind of mix and match, but that's okay. So safety in the pharmacy, personal safety. This is just as far as you as a worker, a few things. And this will come into play in federal law too, just because that's some of the laws that. The other place this would fit into is pharmacy operations, which is the very last chapter. But you may see some of this in between now and then. So of course for you guys, as far as safety goes in the pharmacy, there's substances that can be harmful. One example is anything hormone related. Some of that can actually be absorbed through your skin. So you don't necessarily want to handle a whole bunch of hormones with your bare hands, like touch them with your bare hands, which you really shouldn't do anyways in the pharmacy. But if you did do that, some of that can be absorbed through your hands, through your skin. So, and then there's other substances, especially like at the hospital. There's some things that are toxic. There's some things that have radiation in them that can emit that. And so there's specific ways to handle those. Of course, supplies, any kind of chemicals or poisons that are used just in the pharmacy in general, any kind of equipment. There can be like sharp tools that you use if you're scoring tablets or something like that. Or if you're, cutting tablets. And then improper body mechanics, which we all know about body mechanics. So how to carry things and whatnot. Okay, employee responsibilities is maintain a safe workplace. You don't leave things out. Things out where people, if you've got a knife, you're going to point it down when you walk and things like that. Told y'all before, I had a girl one time in the emergency room who, I guess her parents had left the dishwasher open. She was like 2. And they had put their knives in the dishwasher upwards. And so she fell on them, and it actually it stabbed her in the stomach. And so she had to have surgeries to fix it, and I actually saw her when she had an infection from one of her surgeries. So that's when I saw her. I didn't see her when it initially happened.
Oh, brother does that all the time. I'm like, what are you doing? Turn the knife the other way.
So, because you don't know what's going to happen, and they did. It's not, that was a complete accident. It's not like they were like, I think I'll turn my knife upside down. So, it just, they should think about it. So all that, and that's the thing, we watch those videos, like all accidents can be prevented, the crazy videos that we watch.
Yeah, those are like freaky.
Yeah. So, those are the things to think about. Okay, it says apply principles of body mechanics. You guys know that. Wear appropriate PPE. We all know what PPE is. Say that, don't we?
Sure.
Okay. Gown, gloves, etc. Follow proper procedures, and that it's just so important that you don't cut corners and stuff like this. And it's the same in nursing, it's the same in radiology, it's the same in every area in healthcare and in anything else, but specifically in healthcare. When you cut corners, it can hurt people. You don't know the effects that it could have. Know and apply the policies and procedures in case of emergency. You just need to have an idea, just like we went over emergency stuff before we started clinicals. Always keep an eye about where the exits are. Always have an idea of, it's even like this emergency stuff, here at the school, like I still need to keep in mind, like, kind of have an idea of how I would handle this or that situation. So, environmental safety, clean workplace, proper ventilation. We'll talk about hoods and things like that are used to ventilate, because that is important, especially in the pharmacy. Proper lighting. Okay, you don't want to be counting pills or reading labels if it's dark because you misread it. Adequate setup, the layout of workspace, so people aren't falling and hurting themselves and so forth. If you notice something that's in the way, just move it. If you see there's a rug that's been turned up, like straighten it out so the next customer doesn't fall. Those are the kind of things. Just take care of things. TC, OB. proper functioning equipment. And then the agencies we've talked about, remember that OSHA is the agency that's specifically for healthcare worker safety. BA, FDA, we talked about the rest of those. Okay, safe practices. Patients trust pharmacy personnel to provide accurate and competent service. Okay, when people go home, they don't inspect their pills when they start pouring them into their hand to take them. Like, they trust that you as the tech and the pharmacist have put the correct medication in there with the correct dosage and that it's clean enough for them to take. Okay, so they trust that you've washed your hands after you went to the bathroom before you filled their medicine label. They trust that you put the right label on there. They trust that you put the right medicine in there. Because they don't know. You know, now some people will know if it's off, they're going to be like, this pill is too big, or this pill is purple, it's supposed to be yellow. But some won't. They just take it. They don't ever pay attention to it, you know. And so that's a big responsibility to have. Safe and effective medications, they trust that you're going to give them that, and they trust that you're going to dispense it the way that the person prescribed it. The right instructions on there. Okay, the pharmacist has to make sure, and this is the same for the tech. There's 5 rights, although here, there's 6 on this one, the right attitude, but there's 5 rights of medication. This is the same for nursing. You always make sure you have the right drug, the right medication. You always make sure you have the right patient, so it's going to the right person. You verify their identity. If you're in the hospital, you check their name band. Right dosage, so the right amount, the right route. So are they supposed to take it orally? Are they supposed to take it, you know, are they supposed to get a shot? Is it supposed to be IV? How is it supposed to be taken? And then at the right time. Okay? Does it have the right time on it? And then with the right attitude. Okay, the practitioner, it says, must be familiar with any common side effects, contraindications. We've talked about that. Contraindications means you don't need to take it with another medicine. Any kind of reaction, like food or other drug reactions. And there's some specific drugs. I mean, all drugs have some side effects. They're all going to react, you know, with some things. But there's some that are very specific. Like, there's specific medications you're not supposed to eat with grapefruit. There's specific meds like Coumadin or warfarin, the blood thinner. You're not supposed to change your intake of like spinach and leafy green vegetables because vitamin K counteracts it. And those are foods that are high in vitamin K. So there's some drugs that are specific, that have specific things you wouldn't want to eat with them and so forth. And those are the kind of things you really need to take note of. And then generic drugs that may be substituted, so you need to have an idea. Now, obviously, you're not going to memorize every side effect to every drug that there is. Okay, that would be absurd. But especially drugs that are common, those are ones that you need to know. Because in all likelihood, if you have a drug that's really abnormal that you don't usually prescribe, you're probably going to read up on it anyway. Not that you would prescribe it, that you would fill. Okay, so as a practitioner should know at minimum the following information for the drugs most used in individual practice setting or geographical location. So the things that you're going to use the most. And that's why I picked the medications for you guys to learn. These are all off of that top 200 list, okay, of mostly frequently prescribed medications. Okay, you need to know adverse drug reactions, side effects, contraindications, the dosage range, drug and food interactions, common dosage. Usually you can tell if the dosage range is off, because if you filled it several times, you're going to have an idea of how much people should take. And if something comes across and you're like, wow, that seems like a really big dose, or maybe the doctor prescribed 12 milligrams, but it only comes in 50 milligram tablets, well, that's kind of odd. So maybe they wrote it down wrong or meant for a different medicine. Does that make sense? Like if they wrote for it in a prescription, like for a pill or something, and you can't make that number with the pills that you have, you know, that's a red flag that says, okay, maybe something's off here. Does that make sense? Okay. Drug and food interactions, common dosage regimen. So how is it normally prescribed, dosage forms, and then route of administration. So those are things that you would need to know about your most frequently prescribed medicines. Refills, you need to always make sure the doctor has to write the number of refills on there anyway, so you need to verify it. Make sure you get the right drug. That's always important. And then significantly early or late request for refills may indicate medication misuse. So that's like, okay, let's say you gave them their medicine and then a week later they're already in asking for more refills. That should say, okay, they're taking their medication wrong. It's a pain medicine. That might say that there's something else going on. Maybe somebody's stealing their medicine. Maybe they have a grandchild or a son or daughter or something that's actually is stealing their medicines. There's something else going on. Or maybe they just forgot, that they already got them filled. Who knows? Dispensing errors. I think I've told y'all this story before, but one time when I was in nursing school, we, and this just tells you how important it is to make sure you read well. Pay attention to what you're doing. When I was in nursing school, my senior year, my last semester, we all had a community clinical rotation. Some people went to like a school nurse, some people did a nursing home rotation, and I was in it's one professor's class or clinical group, and he actually ran a clinic. He was a nurse practitioner, and he ran a free clinic. It was mostly immigrants is who came through there, and who didn't have any kind of insurance or any way to, anywhere else to go. So the clinic was open every Tuesday, and it was completely free. All the medications were free, the care was free, everything in there, everything was free. But we were the staffers, so the nursing students staffed it. So we had the nurse practitioner, there were 2 nurse practitioners, and then we did the vital signs, we filled the medications, we did triage, and we there was 7 or 8 of us, and we ran the clinic. It was really small. There were 3 exam rooms. It was small. And we just ran people through. And so one day I was in charge of the pharmacy. Okay, so that means I had to fill medicines, and they would bring the prescription back there and we'd fill them. Well, he wrote out a prescription for metronidazole, which is Flagyl. It's an antibiotic. Well, I went and found it, filled my medicine, and I thought it looked kind of weird because it looked like a chewable tablet, and I thought that was kind of weird, but I was just like, I was a nursing student, kind of whatever. And so I filled it and sent him home with it. Well, later that day, somebody else got a prescription for metronidazole. So I went back to the counter. I went back to look, and I realized then I pulled the metronidazole off the shelf, and I knew it was a different bottle than what I had filled from before. And when I opened it up, the pills were different. They looked different. I was like, oh my gosh. So I went back and looked, and I had grabbed mebendazole the first time instead of metronidazole. So they just looked, the names looked similar, and I didn't recognize the difference in them. So anyways, needless to say, I got the phone number of the other patient, called him back, and told him to come back, that I'd given him the wrong medication, and we got it all fixed. But mebendazole is like a worming medicine. You take it to get rid of worms. Metronidazole is an actual antibiotic for stomach bug or something. So anyways, if they had taken that, oh my gosh, their poor little stomach would have been tore up for days. But, the important thing is, one, I recognized what was wrong. I called him and I made it right. And I told my professor, I told him what happened. And he wasn't upset because I'd already fixed it. I'd already made it, called him and had him come back up there and fix it and everything. So anyways, but always pay attention. I learned I will never do that again. I'm glad I did it. That was a good situation.
That was a good time to do it.
Yes. So anyways, it's just, you just really have to pay attention to what you're doing.